Namaskar. Today we are going to learn about this remedy opium from Dr. N. M. Choudhury's Materia Medica. And this is actually a plant remedy. So the source of this remedy is actually a plant, the poppy plant, the poppy, the famous drugs more like morphine are all prepared from this plant itself. So it looks like this, and actually we have this poppy plant, and in which this is the capsule, and when we incise the capsule, a milky juice is discharged, which is exudes, which is then dried, and it is used to prepare the medicine. Okay, so this is powdered, it is dried, it is powdered, and it is used to make the medicine. Now this uh, a remedy belongs to the papaver family, and in homeopathy, as you all know, even if this is a drug, and normally this is a drug, okay, to which people get addicted also, but in homeopathy this is diluted to such an extent that the crude material is not at all found in the medicine. So the medicine obviously is prepared from this drug, but it does not contain anything like in crude form. Okay, so now we know that in homeopathy the principle is that whatever happens in material doses will be cured in potentized doses, right? So the toxicology that this is going to produce, or the symptoms that it is going to produce in the people taking the drug, okay, are going to be the same symptoms that will be cured by this remedy in the potentized form. So now let's learn that what are the symptoms of this remedy when anybody accidentally takes it or takes it due to addiction. So while talking about the toxicology of this remedy, okay, first of all, Dr. N. M. Chaudhary mentions that this remedy, this plant, poppy plant, and this source of the remedy actually contains 20 different alkaloids like morphine, apomorphine, codeine, apocodeine, narcotine, all these. Okay, and there is even resin, pectin, glucose, and other things. Now we find that it is a very, very, very strong poison. This remedy is a very, very strong poison. The symptoms produced depend on the amount of quantity that you're taking. So it can be, you can take, the person might have taken mild doses, or even in increased doses. So in mild doses, we see that it produces a kind of a transient exhilarating effect involving the emotional side of our nature more thoroughly than the intellectual sphere. Okay, so it could produces kind of a state which is very peaceful. Okay, and he also writes that it feels like they are living in a heaven of peace, quiet, contentment, loquacity, hallucination followed by drowsiness is seen. So they feel like they're living in a heaven of peace, quiet, and they feel contented. And that they might become loquacious in this state. They might also hallucinate. Okay, and finally there is a lot of drowsiness. Then we see that there's increased nervous excitability also. Okay, and obviously this is the state why many people are addicted to it. Okay, um, it is all there. Even priapism is there. Now, if the doses are increased, then they have complete and absolute unconsciousness. Complete and absolute unconsciousness. It is not like the pleasant drowsiness that we see here. Okay, the drowsiness which is pleasant is seen in small doses when people are addicted to it. Okay, the amount of doses that they take. But in the large doses, people, it is not that pleasant drowsiness, but it is complete unconsciousness. There's muscular relaxation, red bloated turgid face. The breathing becomes kind of rattling and stertorous. Stertorous means it produces a kind of a noise like you produce when you're snoring, that kind of audible breathing. You don't have to use a stethoscope for it, it is just audible like that only. That kind of a breathing which produces noise. Okay, that kind of rattling, stertorous breathing, contraction of pupil, etc. So all these are symptoms that this remedy produces in toxicological amounts. Okay. Now the patient can no longer be roused even by the most violent means in when he has taken increased doses. So the patient goes into such an unconscious state. You cannot like whatever violent means even you apply, they will not get up. He lies motionless, senseless, and the eyelids are closed and or partially closed. The surface of the body is bathed in profuse perspiration. The face is pale, the lips are blue, and the lower jaw is dropped, and the muscles are completely relaxed. And along with that, we also see that retention of urine happens, okay, and all these things with a large amount of doses. Okay, so this is in short what this remedy and this medicine produces in toxicological effects, meaning in drug like effects in crude doses. Let's see how it cures these in potentized dose. Now let's move on to the specialty of Dr. N.M. Chaudhary, that is the characteristic indications of the remedy that he gives in a very orderly, systematic manner. The first characteristic, according to him, for this remedy is painlessness. Okay, and it can be this symptom can be seen in many diseases, like it can be in diphtheria, abscesses, boils, carbuncles, malignant growths, pneumonia, typhoid, etc, etc, etc. So whatever kind of a situation the patient has, if the patient is painless, the one remedy that you should think of, or deal with other remedies, is painless is opium for painlessness. Now, Dr. Anand Chaudhary also shares that he had once treated a case of blood poisoning, of which again the main symptom was painlessness. The patient was very delirious. There were huge patches of inflammation in different parts of her body. She had fever, very high fever, and the face was also very red, like we talked about when we were talking about the toxicology. And when the doctor questioned her, when Dr. Anand Chaudhary questioned her as to how she felt, her answer was that now I'm feeling a bit better. So that is also a state of painlessness, no? So when the patient is actually, the state of the patient shows you that the patient is not well. The patient is unwell because the patient has so high fever, the face is red, delirium is there. So this actually clinically tells you that the patient is not well. But the patient, when asked, is saying and telling you that he is well, meaning that the state is painless, okay? They're not feeling anything. So that situation then is calling for opium. Like, you have to at least think about opium for such a situation. If the other symptom match, you can obviously give it, and Dr. Anna Chaudhary gave it in this case. She wanted nothing, she just wanted to sleep. So that is the case, and that is the case in which opium helped, because there was also sleepiness, right? So she wanted to sleep and only sleep, and there was stertorous sleep, meaning the breathing was something that you could hear. It was noisy breathing. So now these give us the next two characteristic points, that is sleepiness and stertorous rattling breathing. So when these three important characteristics of opium were present in the patient, that is why Dr. N.M. Chaudhary gave the patient opium, which helped her. So the second important point is sleepiness and sleeplessness, as we now come to it. So in sleepiness, again, opium is very important. The sleepiness is such that the patient feels heavy, the patient feels stupid, and once he falls asleep, it becomes very hard to wake him up. As we've already discussed, that this is also a symptom which was seen in toxicology. So that is how like cures like, and that is the beauty of homeopathy, right? So he feels sleepy. Okay. Now we have few remedies in which the patients do feel sleepy but they cannot sleep. So in opium they feel sleepy and they can sleep also, okay, they are very much able to sleep. But there are remedies like opium, chamomilla, causticum and coca, in which we find that these patients feel sleepy but it is hard to fall asleep, okay. And this situation of sleepiness and this situation of sleeplessness, both are seen in opium. Again, we know that opium is something that we use to make morphine, and morphine is a great painkiller in allopathy in modern medicine. And painlessness is a situation we saw while reading Opium from Materia Medica. So, pain, extreme pain, as well as painlessness. Again, both are covered by opium, because morphine, in crude doses, when we give morphine, the pain goes away. So both the things are there, and in the same way, sleepiness and sleeplessness, both are there. Okay, not at the same time obviously, but in the remedy you might find, you find both the conditions. The opposite conditions are equally characteristic in opium, but it is sleeplessness that is associated with acuteness of hearing. So in this state, the patient might not have acuteness of hearing, but in this state, when they are not able to fall asleep, there is acuteness of hearing, meaning they can hear every small thing. So every small thing, even if the door shuts close very, they're creating a very slight noise, it will be very loud for them. Whatever happens in the house, a slight wind coming from the window, it will be noisy for them. So there is acuteness of hearing for them. Now there's stertorous rattling breathing as well. Okay, and about this acuteness of hearing, as I told you, about the examples. Dr. N. M. Chaudhary also gives a few examples, like they hear the clock striking, the cokes crying, the wagons rattling on the street, the door closing and shutting, and they wake up in the morning unrefreshed and tired. These were few examples that I also wanted to add, which Dr. N. M. Chaudhary himself has given. Okay, and there is a stertorous rattling breathing, and it is also very important symptom. Now, Dr. N.M. Chaudhary also again here gives us a case in which he had cured a middle-aged gentleman who that patient was actually unconscious like for 3 days and was supposed to be suffering from cerebral apoplexy. So he had a cerebral apoplexy, which is stroke, and after which he was unconscious for 3 days, like in a coma. And the case was declared that absolutely it is an absolutely hopeless case. Nothing can happen, and in that patient the only symptom that there was that he had this stertorous rattling breathing. So Dr. N.M. Chaudhary gave him opium, and his breathing became normal then after giving opium, and he fell into a sound sleep. Now until then he was in a intoxicated kind of sleep, right? So he was in an intoxicated kind of state, because of which he was sleeping. But after giving opium, first thing that happened was that the breathing stopped, the stertorous rattling breathing stopped, and the next thing was that the patient fell into a sound sleep, okay, a comforting and quietening sleep, actually a good sleep, okay. And after which he woke up perfectly conscious. So after that sleep he woke up conscious. So that is about the breathing also, okay. Now we go to mental conditions. So opium is also very important for a kind of mental condition. So there's extreme sensibility of all senses, like we talked about acuteness of hearing. So not just hearing, but even all the senses are very heightened. Okay, some of which seem apparently contradictory. There's a lot of sensibility. They all are become attuned to a degree of perfection not to be found in any other remedy. The functions of the eyes, the ears, and the nose become extremely acute in this remedy, and even the faintest sounds and the lightest odors that would escape others are perceptible to these people, and the brain has becomes more active and the eyes listen with terrors of the most intense mental activity. So there is a lot of terror, okay. See, in even in delirium tremens they have this constant look of fright and terror. Okay, they have this constant look that they're frightened. They imagine that they see all kinds of animals and frightful objects are in nervous dread. They're in nervous dread, okay. They feel that they hallucinate also, as we've discussed. So they imagine that animals or frightful objects around, and they have this kind of a state of fright and terror. Okay, and there's dullness of mind. So there are both these senses. See, there is extreme sensibility of all the senses, and along with that we also find dullness of the mind, complete imbecility in them. Again, in the mind, we also see that they believe themselves to be criminals, to be murderers, to be objects of suspicion, and they constantly run away from people, thinking that everybody is after arresting them. So, everybody wants to arrest them, and that therefore they keep running away from people. They believe that they're criminals. This is again a kind of delusion that they're living in, right? So, hallucinations are there, delusions are there. That is what we find in this remedy. Next, moving on to the next thing is also that we find that in this remedy they have it is also a remedy for dementia, okay, the result of long continued habit of masturbation. These It leads to dementia in these people as well. Now, opium is also a remedy which can stop all the secretions of the body except of the skin. So, what is the secretion of the skin? The sweat, right? And this sweat is actually very hot in opium. So, hot sweat. So, they have hot. We have talked about cold sweat in many remedies, like we see it in veratrum, right? We see it in arsenic. So, we see it in many remedies having a lot of diarrhea. But here in opium, there is hot sweat that they have, okay? And opium actually checks all the secretions of the body, but there is this skin having hot sweat which cannot be stopped by opium, okay. And then we see that there is constipation in these people as well, constipation. So about which we find that it is especially of children, okay, and of good natured women. It is not merely so in this constipation. See, when we talked about nux vomica, we have seen that in nux vomica the constipation is because there's reverse peristalsis, right? Reverse peristalsis gives rise to constipation in nux vomica. But when we talk about opium, what is the cause that is leading to this constipation? Yes, there is dryness of stools, but it is not merely dryness which leads to constipation in opium, but to a great extent, it is also because of the inertia of the rectum and also the entire intestinal tract. So it is kind of an inertia. So for example, it is a kind of paralysis, not exactly paralysis, but it is a kind of a state where there is inaction of the rectum and of the intestinal tract. So in Naxomica, we had talked about reverse peristalsis. So the normal peristalsis should be pushing the stool down, whereas in Naxomica it is pushing it up. But in opium, we see that the peristalsis is not there. It's not happening. There's want of peristalsis or peristaltic action. Okay, and therefore there is want of stools or evacuation for days at a time. So they can experience constipation for many days at a time. Okay, but we have great want of sensibility also, so meaning that we have seen that there is acuteness of senses, in the same way there is dullness of senses in opium as well. So the senses are so dull that even if they have not passed stools for week month for sorry for few days, but still they will not feel the urge as much, or they will not experience the inconvenience because the stool has been accumulated for so long, because the senses are not very acute, they're dull. The senses are not sharp, they're dull. And since the senses are dull, they're not feeling that inconvenience which actually normally a person should feel. That also happens. And the stools are very characteristic. Okay, they are hard, they're small, they're round and black balls like sheep's dung. And this is how a sheep's dung looks like. And that is what we see in this remedy also. So the humans, the patient has this kind of stools, round black balls which look like sheep's dung, and these are so hard that they make a sound as soon as they strike the vessel. Okay, and now this also reminds us of various remedies for constipation, that as chelidonium, plumbum, thuja, bryonia, and silica. Okay. Now we talked about constipation. Now let's talk about diarrhea. So this remedy is all about both the things. So we've talked about pain and painlessness in this remedy. Then we've talked about sleep and sleeplessness in this remedy. Then we also did talk about the kind of senses which are acute as well as which are dull in this remedy. And now we're talking about constipation and diarrhea both in this remedy. So they have constipation, and in the same way they also do have diarrhea. Okay, so diarrhea in this remedy is most often brought on by a kind of sudden joy and fear which is there in this remedy. Okay, sudden fear, sudden joy, or any other emotional disturbance. And the stools are involuntary; they're black. So again, in constipation also the stools were black, right? They were like sheep dung, and even in diarrhea the stools are black and offensive. And the abdomen again becomes tympanic, hard, swollen, sensitive to touch. Okay, so all these are there. Along with it, if you have a kind of diarrhea like like it is seen in cholera, the patient might even have advancing coma and other brain symptoms along with the diarrhea. Now, this remedy is also very important for retention of urine, which is due to excessive use of tobacco, or if nursing children are there, and after a fit of passion in the nurse, they get a retention of urine. Also, it is due to actually paralysis of bladder or the sphincter. After paturation, also it is seen. So again, see, paralysis comes here. So a case of a state of intoxication where the nerves are not able to act, they go into inaction. And it is a great remedy for typhoid, typhus, when the patient again is in the same state. So the patient is in delirium, muttering, the eyes are glistening, the face is red, the senses are dull, and there's a stertorous breathing or snoring or profound coma. The pupils are, greatly contracted or widely dilated. Again, both the polarity, both the opposites are there. They can be greatly contracted, sorry, and widely dilated. So both the things. So any kind of these things. So again, it is indicated in such situations. So that's all about opium that Dr. N.M. Choudhary talks to us about. So we started talking about toxicology, Just to revise, and what are the symptoms that opium produces in toxicology. Later on, we went on to talk about the pain and the painlessness kind of state, the sleeplessness and sleepiness, the breathing, the mental condition in which the senses were very sharp or very dull, or very acute or very dull. They could hear minimal voices also, and sounds also, and the the smell is very strong. They can smell the slightest odors, and they have kind of delusions, hallucinations, muttering delirium, etc. And then we talked about these things as well, in which constipation had the sub cheap dung like stools, diarrhea also had black stools, and the important thing in diarrhea was that it was brought on by emotional disturbances. Retention was of urine is also there due to paralysis of bladder, and constipation was also due to inaction of the peristalsis or want of peristalsis, inaction of intestines or rectum. So all these things are present in the remedy opium, and that's all for today. Thank you.